Okay, now on to labor and delivery. So, first question is talking about what we did to prepare for Maggie's epidural. And so, I would have educated her about pruritus before giving her that. That way, she is aware that is a possibility and see if she can actually deal with the itching all over her body, palpitations, vertigo, if she has any metallic taste, meaning that maybe it was placed in the wrong location. So we really want to know if she is having any of those symptoms. Appropriate way to bend her back while she is getting the epidural and to stay really still. Also, we want to fluid load her with 3 to 500 normal saline lactated ringer. This is going to help prevent that maternal hypertension and fetal bradycardia. The next thing is pretty much preparing the equipment that we need. We know that we're going to pretty much do a Foley cap on her, so make sure that we have everything we need afterwards, and then make sure we're checking her blood pressure every 2 to 5 minutes after we've placed that epidural. The next question is going to talk about intrauterine resuscitation. So she looks like she had a prolonged decel. So for this, we're going to turn her on the left side. It's going to help with the inferior vena cava syndrome. We're going to check the blood pressure. We're going to give O2 8 to 10 liters to make sure that the baby's getting enough oxygen. And we're going to do the IV bolus, normal saline. This is going to help with maternal hypotension and fetal bradycardia. And we're going to, the turb, we're going to give it to decrease the uterine contractions. We want to look for side effects like the increased glucose, increase heart rate, and then we want to stop Pitocin. And then the next question is the what we're anticipating to do to help with delivery, because she is having retractions of the baby's head. So what I'm going to do as a nurse, I'm going to first write down the delivery time of the baby, how long the baby is on the perineum. Another thing that we can also do is do the Robert's maneuver with the suprapubic pressure, since this is a large baby and it's going to help with the pubic, pretty much the pubic symphysis bone. The head usually gets stuck on there, so by putting that pressure, it relieves the pain, and by doing that Robert's maneuver, it allows for that pubic area to pretty much open up. So those are the things that we're gonna do. The next one is nursing interventions. Uh, um, Next one is actually medications. So and things that we would do interventions. So it would be call the provider. If I see clots, the clots, it looks like extremely large clots, so I'm going to want to inform the provider. The medications that we can give a pregnant woman is Methogen to prevent postpartum hemorrhage. Contraindications, hypertension, 0.2 milligrams. That's probably the one that I would give this patient, because I would not give her Hemabate, because she has a history of asthma, which is a contraindication of giving Hemabate. And with Hemabate, we give 250 micrograms IM. Side effect is nausea, vomiting, and we're not going to give this. The next one is the Meso Cytotec. So that one we would give 800 micrograms suppository. Also, same side effects as the Hemabate. Oxytocin, also 30 units. 500 milliliters lactated ringer. It's a premix solution. And then also, we can also think about heparin. It can be used to avoid clotting, and for it can also prevent the patient to going into like DIC. We could put the head of the bed down. That way we're getting perfusion to the brain. The next one is the QBL. So for that one, explain what that is and how it's determined. So the QBL is usually measured using a scale, and it's quantified data versus the EBL, which is more of subjective. So it's pretty much we're just guessing the amount of blood. Yeah.